Good day, everyone. You're welcome to my YouTube channel, Everything Medical. On today's video, I'm going to be treating the anatomy of the axillary artery. It is one of those vital arteries in the upper limb. In fact, it is the main arterial stem of the upper limb that blood vessels supply to the upper limb structure. It is from the axillary artery because the axillary artery courses downwards in the upper limb, which give rise to the brachial artery. The brachial artery give rise to the ulnar and what? The radial artery. In my next video, I'm going to be treating the anatomy of the brachial artery and elbow anastomosis before we delve into ulnar and radial artery. So today's class is all about the anatomy of the axillary artery. The first thing to note about this artery is that it is the main arterial stem of the upper limb because it originates from the outer body of the first strip, that is the downward continuation of the subclavian artery that originates from the convexity of the aorta or the aortic arch. Okay, so let's dive into the class properly. The first thing to note is the introduction of this topic. The introduction. What is axillary artery? Axillary artery is the main artery of the upper limb, which is a downward continuation of the subclavian artery. That is the concept of the axillary artery. It is the main arterial stem of the upper limb, which is the downward continuation of the what? Of the subclavian artery. As you can see here, this is the first strip. The first strip. The first strip. The first strip is the most curved strip we have. It is arched. You get. So this is the first strip. Now, here is the outer border. I mean the inner border. This is the inner border of the first strip. While here is the what? Outer border of the first strip. So from this region to this region remains the subclavian artery. Subclavian artery. Now, from the outer border continues downward to this region remains the axillary artery. Okay, so that is why the axillary artery is a downward continuation of the subclavian artery, because the subclavian artery arises from the convexity of the aorta or the what? Aortic arch. Okay, here is the inner border of the first strip. Inner border of the first strip. Okay, so that was the introduction. The next we're gonna be looking at is the origin. The origin. What is the origin of the axillary artery? Axillary artery originates from the outer border of the first strip. The outer border of the first strip. The outer border of the first strip. Okay. The outer border of the first strip. It originates from the outer border of the first strip. Outer border of first strip. Now, the next outline that we are going to be looking at is the cause. The cause. The cause. What is the cause of the axillary artery? Axillary artery causes in the axilla. Recall that in anatomy, the structure that is passing a particular region takes the name of the region that is passing through. When the subclavian artery courses along the upper thorax, to give or supply to the important structures in the thoracic region. When it courses laterally, going along the axilla, it takes the name of that region. That is why it's called the axillary artery. Now, when the axillary artery enters the brachium, which is the arm, the name changes because the arm can be called brachium. So the name becomes the brachial artery. At the level of the neck of the radius, that is the elbow region, the brachial artery changed the name, thereby bifurcating into two terminal branches. the lateral terminal branch, the ulnar artery, and the smaller terminal branch, the radial artery. So you could see that, yes, the structures take the name of the region they are passing through or they are coursing through. You get. So the course of the axillary artery is that it courses in the axilla from the apex to the base. It courses in the axilla from the apex to the base along the lateral wall, nearer to the anterior wall than the posterior wall. As the axillary artery courses in the axilla, it is being crossed by the superficial branch of the pectoralis minor muscle, which divides it into three parts. The first part, which is the superior part, that is proximal to the muscle. The second part, which is the what? The posterior part, which is deep to the pectoralis minor muscle. The third part, which is the inferior part, that is distal to the pectoralis minor muscle. You get. So that is all about the course of the axillary artery. It courses from the apex to the base along the lateral wall, nearer to the anterior wall than the posterior wall. Okay. So from this outer border of the first rib, you get to the inferior border or the lower border of the teres major muscle is the course of the axillary artery. You get. Okay. The next we're going to be looking at is the termination. The termination. Yes, it has an origin. It must have a termination. What is the termination of the axillary artery? Axillary artery terminates at the level of the inferior border or the lower border of the teres major muscle. You get. This is the teres major muscle. This is the superior border, which is the axillary artery. Because from the outer border of the first rib to the superior border is all about the axillary artery. But once it gets to the inferior border or the lower border of the teres major muscle, it becomes the brachial artery. That is the level of the termination. So the subclavian artery terminates at the level of the outer border of the first rib, which gives an origin of the axillary artery. Now, the axillary artery terminates at the level of the inferior border of the teres major muscle, which gives an origin of the brachial artery. You get. So this is our teres major muscle. Teres major muscle. Here is the inferior border of the teres major muscle. Is a landmark. The inferior border of teres major muscle is a landmark because it indicates the termination of the brachial artery, which gives, the termination of the axillary artery, which gives an origin of the brachial artery. The outer border of the first rib is a landmark because it gives an origin of the axillary artery, which indicates as well the termination of the subclavian artery. You get. Now, recall that as the axillary artery courses along the axilla from the apex to the base, it is being crossed by the superficial part of the pectoralis minor muscle, which divides it into three parts. The first part, second part, and the third part. So here is the pectoralis minor muscle. The pectoralis minor muscle, which divides it into three parts. The first part, second part, and the what? And the third part. Okay, we have discussed the origin, the cause, and the termination. You get. The next we're gonna be looking at is the branches. The branches. The branches. The branches. The pectoralis minor muscle divide the axillary artery into three parts. Now, the axillary artery has 6 branches, which is being divided into 3 parts by the pectoralis minor muscle or the pec minor muscle. Okay, the first part can be called the superior part. which is proximal to the what? Pectoralis minor muscle. It's the superior part. Okay, we have number one artery on the first part is the superior thoracic artery. Superior thoracic artery. Look at the superior thoracic artery here. This is the first part. So here it becomes the superior thoracic artery. Superior thoracic artery. The second part can be called the posterior part, which is deep to the pectoralis minor muscle. It can be called the posterior part. We have two branches from the second part or the posterior part. We have the thoracoacromial artery or the acromiothoracic artery. Thoracoacromial artery or the acromiothoracic artery. The second branch from the second part is the lateral thoracic artery or the long thoracic artery. Lateral thoracic artery or long thoracic artery. Okay, this is the acromiothoracic artery or thoracoacromial artery. Thoracoacromial artery. Thoracoacromial artery. Why here is the lateral thoracic artery or the long thoracic artery. The lateral thoracic artery or the long thoracic artery. So these are the two branches from the second part, which is posterior part, that is deep to the pectoralis minor muscle. Okay, the third part can be called the inferior part. It is distal to the pectoralis minor muscle. We have three branches from the third part. Number 4 is the subscapular artery. The subscapular artery. The number 5 is the anterior circumflex humeral artery. Anterior circumflex humeral artery. The number 6 is the posterior circumflex humeral artery. Okay, so the branches of the axillary artery is of 6 branches. 1, 2, 3, 4, 5, 6. So these are the branches of the what? Axillary artery. Okay, now look at the third part here. Here indicates the posterior circumflex humeral artery. The posterior circumflex humeral artery. Why this indicates the anterior circumflex humeral artery. Okay, this is the largest branch of the axillary artery from the third part. It is called the subscapular artery. The subscapular artery. Subscapular artery. It has a large branch known as the circumflex scapular artery. The circumflex scapular artery passes through the upper triangular intermuscular space and went around the lateral border of the scapula, where it enters the infraspinous fossa of the scapula. You get. So this is the circumflex scapular artery. Here remains our brachial artery. So brachial artery, which crosses along the arm, you get. So from here, from the outer border of the first rib to the inferior border of the teres major is our axillary artery. So this is our axillary artery. Axillary artery. Okay. This is our coracoid process of the scapula. Coracoid process of the scapula. Coracoid process of the scapula. Okay. Now, the superior thoracic artery is actually the smallest branch of the axillary artery. It arises near the subclavius muscle, where it emerges or passes between the pectoralis minor and pectoralis major muscle, in which it supplies to it and also supplies to the medial wall of the axilla. That is the superior thoracic artery, which is a first part of the axillary artery. The thoracoacromial artery or the acromothoracic artery emerges at the upper border of the pectoralis minor muscle, where it pierces the clavipectoral fascia to break or give a branch. And these branches it gives are the 4 branches. It gives 4 branches known as the pectoral branch, the acromial branch, the clavicular branch, and the deltoid branch. The pectoral branch supplies to the pectoral muscles. The clavicular branch supplies to the sternoclavicular joint. The deltoid branch ascends upward to form an anastomosis or continue with an anastomosis over the acromion process of the scapula. And as well, the acromial branch supplies the important structures in the shoulder region. Okay. The lateral thoracic artery can be called the long thoracic artery. It emerges or runs along the inferior border of the pectoralis minor muscle, in which it supplies the pectoralis minor muscle, the pectoralis major muscle, and the serratus anterior muscle. In female, the lateral thoracic artery is large because it provides important structures to the mammary gland through its lateral mammary branch. It provides important structure, or it provides important supply to the structures, that is the breast. That is why it has to be its lateral mammary branch. That is the lateral thoracic artery. Okay. The subscapular artery is actually the largest branch of the axillary artery. It courses along the lower border of the subscapularis and ends along the inferior angle of the scapula, where it gives off a large branch known as the circumflex scapular artery. The circumflex scapular artery passes through the upper triangular intermuscular space and winds around the lateral border of the scapula, in which it enters the infraspinous fossa. It has small branches as it enters the infraspinous fossa to supply to those structures in that region. Okay, the anterior circumflex humeral artery is a small artery which passes in front of the surgical neck of the humerus to form an anastomosis with the posterior circumflex humeral artery. It has an ascending branch which passes along the intertubercular sulcus of the humerus to supply to the head of the humerus and the shoulder joint. The posterior circumflex humeral artery is larger than the anterior circumflex humeral artery. It's very, very large. It courses backward along the axillary nerve in the quadrangular intermuscular space and passes along the posterior aspect of the surgical neck of the humerus, in which it unites to form an anastomosis with the anterior circumflex humeral artery or vessel. It supplies to the shoulder joint. So those are the cause of these arteries. Okay, this is the smallest branch of the axillary artery. Why? This is the biggest branch of the axillary artery. Okay, and next is the relation. The relation. The relation of axillary artery is just the axillary nerve. The axillary vein. The axillary vein lies medially along the course of the axillary artery. It is the what? Axillary vein that lies medially along the course of the axillary artery. Although the course and branches of the brachial plexus are also related to the what? Axillary artery, but it depends on the branches of the what? Axillary artery. Whereas the axillary vein courses medially along its course in the axilla. So the relation have been discussed about the axillary vein and the course and branches of the what? Brachial plexus. Okay. The next we're going to be looking at is the clinical relevance. But before that, I'm going to be giving a mnemonic to remember the branches of the axillary artery. The mnemonic is sulla thoraco pars. This is the first part. Second part and third part. So su is superior thoracic artery from the first part. La is lateral thoracic artery. You get? And this is thoracoacromial artery. Then P is posterior circumflex humeral artery. A is anterior circumflex humeral artery. While S is the subscapular artery. So sulla thoraco pars is actually a mnemonic to remember the branches of the axillary artery. Okay. The next we're going to be looking at is the clinical relevance. The clinical relevance. Number one is ischemia. Ischemia. Yes. Ischemia could occur when there is a blockage of the axillary artery, whereby there will be hypoperfusion to the upper limb structures, because there is already a blockage of the axillary artery, which results in what? Ischemic state of that tissue in the upper limb. So number two is avascular necrosis. Avascular necrosis. Avascular necrosis could take place whereby there is no blood supply to the upper limb structures, because there is entire blockage of the axillary artery, resulting to the what? Avascular necrosis of the upper limb structures, whereby there is the death of those tissues because there is no blood supply entirely. So it occurs as a result of blockage to the axillary artery in the upper limb structures. In the upper limb structures per se, because there is no blood supply at all. In ischemia, there is small blood supply, but in avascular necrosis, there is no blood supply entirely. Necrosis simply means death of tissue. So those no blood supply result to what? Death of tissues in the upper limb structures. So it is called avascular necrosis. Then number three is thrombolism. Thrombolism simply means the formation of thrombus, that is intravascular blood clot on the blood vessel wall. Yes, that could be formation of intravascular blood clot on the wall of the axillary artery. You get, which is not good. It could result to what? Hypoperfusion of blood, because there is already a small passage of blood in the blood vessel. So it is called thrombolism. The next is number four, which is embolism. In embolism, those intravascular blood clots will dislodge from where it was formed or to the initial site it was formed to another place, thereby causing what? Hypoperfusion to that particular place. So it is the dislodging of the intravascular blood clot to the original site to another place. You get, it is known as the what? Embolism. The dislodging of intravascular blood clot forming embolus in another place. So the number five is simply aneurysm. Aneurysm simply means abnormal dilation of the blood vessel wall. It could result as a high blood pressure, that is hypertension. You get. So the axillary artery could dilate, whereby there is a pressure exerted on its wall. So it is known as what? Aneurysm. Okay. Now number 6 is coarctation. Yes, there could be tightening of a particular region in the blood vessel wall. You get. That is in the axillary artery. Those are clinical conditions that are associated with it. Now, the next is collateral supply. Collateral supply. Yes, it provides blood supply to the upper limb structures. So it ensures collateral supply to the upper limb structures. Okay, those are the everything that is associated with the anatomy of the axillary artery. Very, very important. But there's one thing I want to chip in concerning the posterior circumflex humeral artery and anterior circumflex humeral artery. Recall that these two branches from the third part forms an arterial circle in front of the surgical neck of the humerus. This is what we call an arterial circle in front of the surgical neck of the humerus. They're mostly supplied to the shoulder joint and the head of the humerus. Okay, that was the flashback. So I believe you enjoyed this class very, very well. We have done justice about the anatomy of the axillary artery. I believe you enjoyed it. Nothing is left. We dealt with everything. Okay. Thank you so much for staying into this class. Anticipate for more video on the upper limb structures and other areas or other region of anatomy. Thank you so much.